My name is Julia Buxton. I'm Professor of Comparative Politics in the School of Public Policy at the Central European University. And one of the issues which is really key, very, very important at the moment in terms of drug policy reform and drug policy debate are issues around the relationship between drugs and development. We have a hugely significant UN General Assembly special session in 2016 on drug policy, whether there is scope and manoeuvre for reform. And at the same time, in 2015, we have this process of elaborating the post-2015 Millennium Development Goals and looking at the agenda for the future. One of the key issues for the drug policy reform community currently is trying to deepen this relationship between the drugs community and the development community, and most specifically that we engage the development community in understanding that drugs is a development issue and it needs to be recognised as such. The traditional model of controlling narcotic drugs has always pivoted around either law enforcement, which is focused on eradicating crops such as coca for cocaine production and opium for the production of, for example, morphine, heroin, the opioids. So either law enforcement, eradication, interdiction, criminal justice approaches, or an approach which we call alternative development, which is trying to address the drivers of engagement in the drug trade. Why do people participate? Why do people cultivate narcotic drugs and traffic them? What's been very, very important over the last 20 years, and specifically since a landmark document in 1998 by the United Nations, has been recognition that it is poverty which is the key driver of engagement in the drug trade. So what we've had is a greater institutional emphasis within the UNODC on the importance of alternative development. Now, this has been very well received in the drug policy reform community and people who are very much focused on trying to understand how we can better eliminate this trade in narcotic drugs by tackling it at cause. But the problem that we have is that these alternative development projects, even though we're seeing them rolled out, even though we're seeing more donor investment in alternative development projects, is a very serious concern that these may actually be causing more harm than good. Now, when we look at somewhere like Afghanistan, where we've had, for example, over $7.5 billion spent by the US on counter-narcotics projects, we have the astonishing result that between 2012 and 2013, we had a 36% increase in the amount of opium being cultivated. There is obviously something going very, very seriously wrong with the types of AD projects that are being implemented. Some of the key issues which we need to look at is how is alternative development evaluated? What we're seeing, if we look back at some of these AD projects, is that they are not judged by development indicators. They are actually judged by how much they reduce drug crop volumes, drug crop cultivation. You cannot have a development approach which continues to be framed by goals of drug prohibition. So the whole metrics of the system are based around drugs, they're not based around development. We have incoherence in donor projects, we have ongoing problems of a lack of specialism, of expertise. We have people who are really engaged in AD projects who come from law enforcement backgrounds. These are not development practitioners. And we have this final, persistent and ongoing problem that the people who are engaged in the trade are, under the terms of the conventions, criminals. You cannot engage in development practice stakeholders, which are the cultivators, if essentially we continue to see these people as criminals. So as long as we continue to be framed by prohibition goals, law enforcement approaches, we're simply not going to achieve what we hope to achieve through alternative development. And to reiterate this message, alternative development may actually be causing far more harm than good. Now, drugs are a development issue. The whole issue with the prohibition model is that it is focused on reducing supply from source countries. So this means that some of the poorest, the most fragile, conflict-prone countries of the world are in the front line of northern demands for enforcement efforts. So what we're seeing is that countries like Colombia, increasingly countries of West Africa, obviously Afghanistan, is that these states are being required to commit huge amounts of their budgets to law enforcement, to policing, to criminal justice systems. These are the countries that can least afford to be putting this kind of public revenue into these forms of criminal justice and law enforcement responses. This money needs to be going into development objectives, into education, into health, into schooling. It is a travesty, and essentially the global north is outsourcing the costs of its drug war to those countries of the world that can least afford it. Drugs are a development issue, and it really is essential that the development community engage with drugs as a development issue. What we really want the development community, development agencies, development NGOs to engage with is the fact that the enabling conditions for a thriving drug trade are development related. What we are desperately encouraging the development community to acknowledge is that the enabling conditions, as I said, have to be addressed before we can start moving ahead with issues around law enforcement, criminal justice, prohibition. It's only when we tackle poverty, marginalisation, exclusion that we can begin to push back the advances that we've seen that the drug trade has made in some of the least developed and the poorest countries of the world. What we are suggesting to the development community is that they really have to recognise with us that the drug trade and the presence of the drug trade is a symptom. It is not the cause of the poverty and the violence and the instability, which in effect puts the development community off working in these areas. We really need their engagement in these areas because it is essential for us to achieve these development objectives. Now, the big problem we have with the development community is that the development community has in effect marginalised itself from these policy debates. There is this continued emphasis on drugs as a law enforcement, as a security issue. Unfortunately, and I think to a great cost in terms of the MDGs, we actually saw the original Millennium Development Goals reiterating this idea that we should be fighting drugs. Fighting and development are completely contradictory processes. So what we're really hoping to do ahead of this very, very important UNGAS 2016 special session and in terms of the 2015 elucidation of the new MDGs, the new global development priorities, is we need to see the development community engaging with these debates around drugs. We need to see the development community gathering with us the empirical evidence that the war on drugs has devastating costs for development, that it deprives poor countries of resources, that it targets marginal communities, and that it is really a completely counterproductive approach if we want to achieve development goals, if we want to really reach the poorest of the poor and advance global development agendas. We cannot persist with a prohibition paradigm. So really we need to appeal and work with the development community and encourage them to engage with these issues around access to justice, around human rights, around access to essential medicines, which currently are prohibited, are huge impediments to access to these issues because of this prohibition model. So bringing the development community in and encouraging the development community to recognise its role and responsibilities, a shared responsibility, is really essential ahead of 2015 and of course the 2016 UNGAS.